Hi everyone, I am Dr Sunil Vyas, working as specialist pulmonologist in Aster Hospital, Alkiswes. Today, as you know, the world is going to celebrate the World Pneumonia Day on 12th of November. It has been being celebrated from 2009 annually on 12th of November every year. So this year, the theme of World Pneumonia Day is Stop Pneumonia, Every Breath Counts. As you people might be well known that pneumonia is a very dreadful disease, specifically in children below 5 years of age, and as per the WHO, it's the number one cause of death in children below 5 years of age because of pneumonia. Pneumonia can affect each and every age group, each and every gender, and as you know, the commonest thing which we were having in the last 2 years with this pandemic of the viral pneumonia caused by COVID, the coronavirus, was such a dreadful disease, and majority of the deaths have been because of the pneumonia. Now, looking at pneumonia, pneumonia can be classified based on the organism causing pneumonia. It can be bacterial, it can be fungal, it can be viral, or it can be based on from where, in which setting the patient or the person got affected. One could be a community-acquired setting, which we call it as community-acquired pneumonia. The other setting could be a healthcare-associated pneumonia. So the commonest thing in that is seen specifically in intensive care units as ventilator-associated pneumonia, or a patient who has visited a hospital recently in the last 48 hours and develops a pneumonia can be attributed to healthcare-associated pneumonia. Pneumonia, the best way of preventing pneumonia is almost little bit difficult, because if you come in contact, and majority of the organisms are aerosol borne, so aerosol generation causing from the patient who has pneumonia having cough can also lead to infection to other people. So the most important thing is prevention of cough hygiene when the patient is affected with pneumonia, how he maintains his cough hygiene. Second is then to look at alarming signs and dangerous signs for pneumonia, looking at high grade fever, excessive cough beyond 5 to 7 days, or even to consult a physician or a healthcare provider to see whether he has pneumonia or not. The other signs would be chest pain and cough with some blood streaked sputum. Also, blood streaked expectoration can also lead to the alarming sign. The next would be in viral pneumonias, breathing difficulty is also a common associated factor, which is not seen in other microbiological pneumonias like bacterial. So if somebody having breathing difficulty with features of all these things, he should always get alarmed that this could be a pneumonia and he needs to visit a healthcare provider. So treatment is based on what type of pneumonia we are treating with, whether it is community acquired, whether it is healthcare associated, or where we are looking at bacterial pneumonias, fungal pneumonias, or viral pneumonias. So the treatment is based on how we isolate the organism as well as on what clinical pattern we see in a patient. Now, coming to the most important thing is how to prevent any disease, because we all know that prevention is better than cure. So for children, for so many children, we have a lot of vaccines to prevent them for pneumonias, the diphtherias, the pertussis, all those things. Then we have the meningococcal vaccine also in children to prevent pneumonia, as well as meningococcal disease. Now in adults, what we have is the influenza vaccine, which we need to take it on an yearly basis after the pandemic which the world faced in somewhere in 2008, 2009, and following which we have a pneumococcal vaccine which has been recommended in older age group, and specifically high risk groups with patients with diabetes, chronic renal disease, chronic liver disease, cancer survivor patients, splenectomy patients who are on immunosuppressive drugs, and anybody elderly above 65 years of age should definitely receive a pneumococcal vaccine to prevent him from developing the pneumococcal pneumonia. And the third, which has been the recent vaccine, the coronavirus vaccine, which can prevent definitely, and studies have proven it, that a patient who is vaccinated with 2 doses of the COVID vaccine can get away without developing any pneumonia. So a person who gets even infected with COVID and does not have a pneumonia has a mild disease, and the chances of getting hospitalization as well as further severity reduces significantly. Hence, so we should always target looking at prevention better than cure, and looking at vaccines as an option of preventing pneumonia. As the World Pneumonia theme says, stop pneumonia, every breath counts. Thank you very much.